Rheumatoid arthritis. Most common early signs. Rheumatoid arthritis is a disorder where a person's immune system attacks their joints, causing them to become inflamed. What are the early signs of this condition? The symptoms of rheumatoid arthritis typically affect the hands, wrists, and feet. Spotting signs of rheumatoid arthritis early could lead to an early diagnosis and appropriate treatment. Early and consistent management of arthritis can prevent joint damage and ultimately disability. What is rheumatoid arthritis? Rheumatoid arthritis results from a problem with the immune system. When a person's immune system is healthy, it helps to fight infection. In people with rheumatoid arthritis, the immune system mistakenly attacks the cells in the lining of their joint, resulting in inflammation of the joints, making them swollen, stiff, and painful. People who have rheumatoid arthritis will have some periods where they experience no symptoms and other times when the symptoms flare up. Currently, there is no cure for rheumatoid arthritis, but proper treatment and moderate exercise may help reduce flares. If rheumatoid arthritis is left untreated, the joints, cartilage, and bones in affected areas can become damaged. Early signs. Fatigue. Before experiencing any other symptoms, a person with rheumatoid arthritis may feel extremely tired and lack energy. They may also feel depressed. Feelings of fatigue may affect everyday activities, relationships, sex drive, productivity at work. Feeling fatigued may be due to the body's reaction to inflammation in the joints. Slight fever. Inflammation associated with rheumatoid arthritis may cause people to feel unwell and feverish. They may have a slightly raised temperature, which is an early sign that sometimes accompanies fatigue. It may precede any noticeable effects on the joints. Weight loss. A third early warning sign of rheumatoid arthritis is unexplained weight loss, which is possibly an indirect effect of inflammation. When someone is feeling feverish and fatigued, they may lose their appetite, which can cause them to lose weight. Stiffness. Another early sign of rheumatoid arthritis is joint stiffness. Stiffness may occur in one or two small joints, often in the fingers. It can come on slowly but may last for several days. In addition to the stiffness that affects specific joints, a general feeling of stiffness in the body may be an early sign of rheumatoid arthritis. This type of stiffness usually affects a person after they have been still for a long time. This symptom is the cause of morning stiffness, a characteristic complaint of patients with rheumatoid arthritis. Joint tenderness. Joint tenderness that affects the hands and feet is a typical early sign of rheumatoid arthritis. In the hands, the joint in the middle and at the base of the fingers may feel tender when pressed or during movement. In the feet, the joints at the base of the toes may be tender. This soreness may cause people to walk on their heels or lift their toes up as they walk. Joint pain. Joint pain in the fingers, wrists, and feet is a sign of rheumatoid arthritis. Inflammation makes the lining of the joint thicker and also causes the production of extra joint fluid. Both of these factors put pressure on the capsule that surrounds the joint and irritate the nerve endings that it contains, causing pain. Joint swelling. Joints that look swollen in the hands and feet is a typical sign of rheumatoid arthritis. Joint swelling tends to be more apparent as rheumatoid arthritis progresses, but subtle swelling may be an early sign. Joint redness. Inflammation in the joints may give them a red appearance. Discoloration of the skin around the joints in the hands and feet is a sign of rheumatoid arthritis. Redness occurs because the inflammation causes the blood vessels in the surrounding skin to widen. Wider vessels allow more blood to flow into this area, giving the skin a red appearance. Joint warmth. Joint warmth is caused by inflammation and may be present before redness or swelling occurs. This can be an early sign of rheumatoid arthritis. Numbness and tingling. Numbness and tingling affecting the hands and feet may be an early sign of rheumatoid arthritis. These symptoms are caused by inflammation in the joints that can cause nerve compression, resulting in loss of sensation. Decrease in range of motion. In the early stages of rheumatoid arthritis, a person may notice they are having trouble bending their wrist back and forth. As the disease progresses, damage to the joints can affect ligaments and tendons, making it hard to bend and straighten them. Joints affected on both sides. It is common for people affected by rheumatoid arthritis to experience symptoms in the same joints on both sides of the body. While this symmetry is typical, it is not the case for everyone with the condition. Complications. If left untreated, rheumatoid arthritis can damage the joints, the surrounding cartilage, and the nearby bones, leading to joint deformities. Untreated rheumatoid arthritis can also lead to firm lumps developing on or near the joints called rheumatoid nodules. These nodules are a visual characteristic that people often associate with the condition. In addition to joint deformities and rheumatoid nodules, rheumatoid arthritis can also lead to carpal tunnel syndrome, inflammation in other areas of the body, including the eyes, heart, and lungs, greater risk of heart attack and stroke.